You have an itch, so you scratch it. Big deal. But what if your common run-of-the-mill symptom was actually a sign of something more serious? One woman says her itchy skin turned out to be a sign of cancer. Joining us now is oncologist Dr. Piro to weigh in on not only this story, but other things that we need to be paying attention to, because people will not think, oh my gosh, I have unremitting itchy skin, or every night I wake up and everything itches. It can be a sign of cancer, can it not?
It's one of the craziest things. No one thinks a serious disease like cancer would be associated with a seemingly innocent symptom like itching, but it's true. And so in this woman's case, she went to the doctor, she left with her treatment for eczema, which was the explanation of the itching, and as she was going out the door, she says, well, by the way, what do you think about this big lump I have, right? So the doctor felt it, thank goodness, exactly. So you really have to be your own advocate. When you're having a symptom that doesn't make sense and it hasn't been in your body before and it's recurring and bothering you, you really got to tell everyone everything because it's a puzzle.
What kind of itching are we talking about?
Well, generally you're talking about entire body itching, right? You're not talking about one particular focal area. And you're talking about itching that isn't associated with any obvious skin abnormality. So if you obviously have a rash or something like that, that's common, but this is uncommon. But I think the most important thing that characterizes this kind of itching is it comes out of nowhere, and it involves your whole body, and it's recurring. I mean, it like drives you crazy. You know, you're trying to sleep at night, and the blankets on you make you itch more. And when this happens, people are very, very desperate to get attention.
Now, really quickly, just because I don't want everyone to be in a panic, most causes of itching are a local inflammatory reaction. So I just, you got to pay attention to your body, but I don't want everyone at home, if they have one little itch behind their ear tonight, to think, oh my gosh, it's cancer. But this gets back to paying attention to your body. What are some other maybe seemingly innocuous things that we need to look out for?
Well, another one in that same category is rectal itching. Rectal itching can be a sign of colon, rectal, or anal cancer. And that's obviously a very common sign. And most of the time, it isn't a sign of anal cancer, rectal cancer. Most of the time, it's actually a sign of people who are being overly aggressive about their hygiene and scrubbing that area too much, and it gets rid of the natural substances that keep it moist. It gets dry and it itches. So you don't want to be, hyper clean. I mean, please be clean, but don't be hyper clean.
And those types of cancers are on the rise.
Yes, but things like rectal itching, people often attribute that to hemorrhoids or other simple things and don't go to the doctor, and then it's too late by the time they go. And there have been some very well-known, cases in the literature of celebrities and other people who have had anal cancer, and they've even had bleeding, and it's been attributed to hemorrhoids, and then they go in, and it's now relatively advanced. So you really want to get that kind of attention right away. Also, when people have symptoms of their anal area, nobody really wants to go to the doctor and say, hey, could you look at my bum? I mean.
But you should, because doctors literally went to school and learned about that particular area of your body so we could help take care of you. So we are actually kind of counting on you to come in so we can have a job. So please come and talk to us so we can have a job and we can help you. Everybody wins.
Yes, well, and I just want to point out that a lot of doctors don't look at that part of the body. Even a lot of gastrointestinal doctors who you might go to for your colonoscopy, they'll do the colonoscopy, but they don't actually look at the anal area. Yeah. And someone can have a colonoscopy and within a few months have an anal cancer that's undetected that could have been. So I think another important tip is that if you go for your routine colonoscopy, you need to ask your doctor to examine that area and tell him in advance or her in advance that you want that exam done.
And if your regular doctor isn't sure what they're looking at, go see a proctologist who can really focus in on that area.